Hello, this discussion is on chickenpox or varicella. Varicella or chickenpox is an acute infectious disease caused by varicella zoster virus, which is a DNA virus that is a member of the herpes virus group. After the primary infection, varicella zoster virus stays in the body, mainly in the sensory nerve ganglia, as a latent infection. Primary infection with this virus causes varicella, whereas reactivation of latent infection causes herpes zoster or shingles. Varicella is highly contagious. The virus can spread from person to person by direct contact, by inhalation of aerosols from vesicular fluid of skin lesion of acute varicella, or through infected respiratory secretions. A person with varicella is considered contagious beginning 2 days before rash till all the chickenpox lesions have crested, or around 5 days. Vaccinated people may develop lesions that do not crest. These people are considered contagious until no new lesions have appeared for 24 hours. About 90% of susceptible close contacts will get varicella after exposure to a person with the disease. The risk for varicella zoster virus transmission from herpes zoster was approximately 20% of the risk for transmission from varicella. People with breakthrough varicella also are contagious, mainly if the lesions are more than 50. Varicella is less contagious than measles, but more contagious than mumps and rubella. The average incubation period for varicella is 14 to 16 days after exposure to a varicella or herpes zoster rash. A mild prodrome of fever and malaise may occur 1 or 2 days before rash onset. But in children, the rash is often the first sign of disease. The rash is generalized, pruritic, and has erythematous base. It progresses rapidly from macular to papular to vesicular region before cresting. Lesions are typically present in all stages of development at the same time. This is very important in diagnosing chickenpox. Chickenpox lesions are present in all stages of development at the same time. There is macule, there is vesicle, there is papules, and different stages of skin lesions are found at the same time. The rash usually appears first on the chest, back, and the face, then spreads over the entire body. The lesions are usually most concentrated on the chest and the back, and those symptoms typically last 4 to 7 days. Recovery from primary varicella infection usually provides immunity for life. In otherwise healthy people, a second occurrence of varicella is uncommon. When we see varicella in vaccinated person or breakthrough varicella is infection with wild type of virus occurring in a vaccinated person more than 42 days after varicella vaccination. They usually have mild symptoms with a short illness compared to unvaccinated people who get varicella and they develop further than 50 skin lesions. The rash is more likely to be predominantly maculopapular rather than vesicular. Chickenpox is diagnosed clinically. Laboratory diagnosis is not routinely required. Laboratory diagnosis is useful if confirmation of the diagnosis or determination of susceptibility is necessary. Most frequent source of isolation is vesicular fluid. Stained smear from vesicular scraping or zinc smear can be done. The other is serology tests for varicella, IgM antibody, and ELISA, and also latent agglutination. The most common complication from varicella in children is bacterial infection of the skin and the soft tissue. There are also other complications like CNS manifestations, septicemia, toxic shock syndrome, and necrotizing fasciitis, bacterial pneumonia, and septic arthritis. When we came to managing people at high risk for severe varicella zoster immunoglobulin is given for people exposed to varicella or herpes zoster who cannot receive varicella vaccine. Varicella zoster immunoglobulin can prevent varicella from developing or lessen the severity of the disease. This is recommended for people who cannot receive the vaccine and who lack evidence of immunity to varicella, whose exposure is likely to result in infection, and those who are at high risk for severe varicella. This vaccine should be given as soon as possible after exposure, but can be given within 10 days of exposure. Treatment overall is supportive, but AAP recommends that certain groups at increased risk for moderate to severe varicella can consider for oral acyclovir or valcyclovir treatment. The high-risk groups that needs acyclovir or valcyclovir treatment include healthy people older than 12 years of age, those with chronic cutaneous or pulmonary disease, those receiving long-term salicylate therapy or steroid therapy. IV acyclovir therapy is recommended for severe disease and in immunocompromised patients. For maximum benefit, oral acyclovir or valcyclovir therapy should be given within the first 24 hours after the varicella rash starts. So we should have to start as early as possible within the first 24 hours after the varicella rash starts to get the maximum benefit. So as I've said, treatment is supportive. We should have to prevent the child or counsel the child, just do not scratch the skin, and we should have to catch the nail of the children not to damage their skin while scratching. And also we should have to apply soothing lotions and also antipyretics for fever. Prevention is by vaccine and wash hands and also preventing a child from going to school during the first 5 days of rash. Thank you for watching.